Hi, everyone. Welcome to this episode of MedTech Minis. I'm your host, Susie Ingwall, and today I'm here with Sam Molyneux, co-CEO of Poppy Health. Thank you so much for joining us today. I'd love to know a little bit more about you and the problem that you set out to solve.
Yeah, thanks so much, Susie. So great to be here with you. So Poppy Health is a company that I help run, and we're a market leader in advanced technology for delivering healthy, sustainable buildings. And the problem that we set out to solve when we founded the company in 2019 is basically 3 points. So number one, indoor air is the top operating cost for any building. If you look across space types, it's anything between sort of 50 and 65% of the operating cost for any building, incredibly expensive. Number two, it's actually the number two consumer of energy behind transport in industrial societies. And it turns out it also carries 43% of all cases of human disease every year. And so if you look at that in buildings, we have this incredible measurement problem where we just don't know how much air to deliver in terms of equivalent clean airflow for people in buildings to keep them healthy and not overspend on energy. And there's a new standard called ASHRAE 241 that's been written, where we have become the leader in measuring to that new standard, which is something that we can apply to healthcare as well.
That is so fantastic, because I know during the pandemic, everybody jacked up their HVAC to make sure they had proper ventilation. I'm sure a lot of hospitals are overventilating, and they're trying to figure out, how do I balance my sustainability initiatives with what I feel like my patients need, and making sure that I have the right environment. So I love that you guys have a solution to this. Tell me a little bit about what the solution looks like. How does it work?
Yeah, so we invented a class of technology called real-time air tracing. And the way the technology works is we release simulated human breath, or just simple salt water, into the air in buildings. And we have really accurate sensors that can count those particles and measure where they go and how they're cleared. And it turns out that when you can do that, you understand how all the ventilation and dilution and filtration is working in the space, in terms of the HVAC system, in terms of in-room purification that you may have active. And if you remember, during the pandemic, this was the core thing that nobody knew how to measure and manage, which would have given us better infection safety at that time. And so this technology actually solves that problem. It's a robust, simple, low-cost, real-time way to understand equivalent clean airflow. And when you know that, suddenly you can optimize the whole building around that. You can optimize the devices you buy, how you calibrate your system, and even measure yourself to new standards.
That is so cool. And my understanding is too, it doesn't really matter like how big or small the space is. You can optimize it for the space size and for the number of people that kind of flow through it, correct?
Yeah, that's right. The technology can be used in a huge variety of space types. We've used it in everything from large performance spaces. Offices are bread and butter for us. Schools, we're publishing a large data set on public schools in the next couple of months in the ASHRAE journal. And then certainly healthcare, you can apply it there. Fundamentally, what it lets you do is understand clean airflow in the breathing zone based on the number of people that are there. That's what you sort of calibrate your system to. And that is sort of a true thing across a variety of space types, even though you may use those spaces in different ways and have different densities of people. And so it's a very robust technique for that.
This is so awesome. So let me ask you one more question. The cost versus benefit, like right now, hospitals have their lowest number of days cash on hand. It's been really hard for hospitals post-pandemic. Tell me a little bit about how much this costs and what kind of benefits that you think hospitals can get from it.
Yeah, it's a great question. So when we started building the technology, one of the goals that we had was to basically democratize access to it. So make it incredibly cheap and low cost, so it could go everywhere and you could expansively use it through portfolios. What we've been finding is that in Class A buildings with modern HVAC systems that are well managed, we're finding that because they were conservatively designed and conservative calculations were typically applied to them during the build, there's often much more airflow than is needed to meet the new ASHRAE 241 standard. So a lot of what we've been doing now is helping organizations, helping operators figure out, how do we reduce our airflow so it meets this gold standard that we now have, do that in congregate and common spaces in the building, and make sure they're not overspending on that flow.
That's fantastic. So for the cost of what they're putting in, they're probably recouping way more in money. This is so great. I'm super excited about this. How do people learn more about you and your company, or how do they get a hold of you?
Yeah, absolutely. So just on the ROI, we find that we can deliver between 5 and even 53-fold ROI on our cost. So it definitely makes sense from that perspective. You can find us at poppy.com. You can reach me at sam@poppy.com, and we'd be happy to consult and sort of look at your projects and buildings.
And I think you guys, am I correct in hearing that you guys do a free assessment as well?
Yes. So one of the things we've started to do is actually offer free sample assessments for buildings, so you can get a sense directionally of where that building is going to land from an energy savings or under ventilation perspective. We can usually schedule those quickly in a variety of geographies, so feel free to reach out.
Awesome. Thank you so much for being my guest today. I love this technology. I think it's really needed, and I'm so excited to watch how you guys kind of take your place in the market and how successful you are in the future. I'm really excited for you. Thank you so much.
Thanks, Susie. Thanks so much.